is Nurse Stephanie. So I'm going to put in your NG tube, okay? It's just a little tube that goes from your nose down to your belly. Can you tell me your first and last name and your date of birth?
I'm Oliver and Copeland, and January's first and 14.
Okay. And do you have any allergies?
No.
Okay, I'm just going to check your bracelet here. Okay, let me wash my hands. You want some? All right, I'm just going to take a peek up your nose with the light, okay?
Okay.
Can you tilt your head back? Up your nose. Okay, so there's no deviated septum and no nasal polyps. I'm going to put on my gloves. So we have our NG tube, and I'm going to measure it. You can close your mouth, it's okay. We're just going to measure it for now. We're going to go from the tip of your nose to your ear, and from your ear down to your xiphoid process. Yep. So we've got that, 35 centimeters, okay? So I'm going to dip that in some lubricant. Can you tilt your head all the way back for me? Okay, so we're going to pretend to put it up the nose, having curled it around the fingers so it'll angle downwards. We're going to curl it and advance it, and we can rotate it while we advance it. Once it gets to the oropharyngeal, okay, so has it reached the back of your mouth? Can you open? Okay, so now tilt your head down, and I'm going to hand you a cup of water. And you can take little sips, and I'll advance that as you swallow. Okay. Okay. All right, I'll take that. Okay.
I just do a little baby set,
That's
little
perfect.
baby drink.
Okay. You want to hold it for me?
No?
Here, hold it right there. Thank you. Okay. So I'm
I
gonna,
literally got it sticked on there.
here, we're just gonna stick it.
Can't flip
I
it.
got it. I got it. You can put your hand down. You can put your hand down. Thank you. Okay. So we've got it taped. I'm just gonna sit down because I can't raise your bed up. My back's hurting. So I would get a chest x-ray to verify placement. But first I would take a syringe and aspirate. Just leave it because we're going to take it off. Okay. I would get a syringe and I would aspirate 30 mLs. And then I would test the pH of the gastric contents. Okay. And we looked in your mouth and we know it's not coiled, right? Yep. All right, so that's the end of inserting it. I would do a more secure tape. Don't pull it off. Don't pull it off. Okay, I would do a more secure tape once that placement is secured. Just hold it right there for a second. Okay, and now we're gonna pretend to take it out, okay?
Okay.
Ready? Okay. So I'm going to just verify the order, and I'm just going to explain to you that we're going to take it out, okay?
Okay.
So I'm going to take our pretend syringe, and I'm going to insert some air. And I'm just going to pretend to push 30 mLs of air up through the tube, so anything that is in there goes back down in your belly, okay?
Okay.
Okay, and then I'm going to take the tape off.
Ow. Oh.
Here, don't push it away. Don't push it away. I gotta pretend to take it out. Put your hands down. Thank you. Okay. So we got that. And now I'm going to...
It was hard to smooth some my...
Yeah.
It's
Okay.
so
So I'm going to kink it, and I'm going to pull it. And once it gets up towards the top, I'm going to quickly remove it from the nares so that it doesn't drip anything on him, but it shouldn't because it was already drained. And then I would assess how he handled the procedure and document and dispose of it. You handled it well. Silly goose, you're fun.